Hello, my name is Dr. Robert Kaufmann, and we're about to go beyond terminus. Sometimes it's necessary to remove a post. This most often occurs due to the need for endodontic retreatment or re-restoration of the tooth. Posts can be divided into one of three categories. Metallic posts, consisting either of a prefab stainless steel, metal, or cast post, the second one being a fiberglass post, and the third one being Dentatus type brass screw posts. Whenever we consider removing a post, we always have to recognize that a certain amount of tooth structure may have to be removed in order for us to remove the existing post or make room or provisions for post replacement. Loss of the dentin is never a good thing, so every effort should be made to try to conserve as much of the tooth structure as possible during post removal. The first thing to consider is the amount of engagement of the post with the existing natural tooth. Most posts can be removed by trimming the surrounding restoration and judicious use of ultrasonics combined with water spray to trough around the post and eventually provide enough ultrasonic vibration to loosen the post. Under no circumstances should ultrasonics be used without adequate water cooling. Prolonged use of ultrasonics up against the metallic post can easily heat the post to the point that damage can occur in the periodontal ligament due to overheating of the adjacent dentin. Fiberglass posts are much easier to remove, but they do require a bit of work because the fiberglass tends to come apart either while being removed with ultrasonics or with appropriately sized burrs. In all cases, we have to have excellent light and visualization as well as an idea of exactly how deep these posts are. If you have any questions about it, stop what you're doing, take a conventional image or CBCT radiograph and confirm that the direction you thought you were going matches the direction of the post in the canal. It's easy for instruments to be deflected and perforated in these cases by the metal post. In the case of metallic posts such as the parapost, small ultrasonic tips can be used to remove the peripheral material such as amalgam, composite, or cement that surrounds the post. Once this is done, ultrasonic vibration is applied to the post until it loosens. It's been my experience that most of these parallel-sided posts can be removed quite easily, as they're mostly retained by the cement, which can be fairly easily broken up by application of these ultrasonic forces. Cast posts can be far more difficult to remove, especially when they are cemented with something like Panavia cement. The fit is intimate because they're custom cast and the cement layer is often very thin. In those cases, you have to be extremely patient and it may take some time. You may have to remove a lot of the core material before the post loosens sufficiently to allow for removal. Similar to tuning a guitar or violin string, you must find a resonant frequency which allows the post to vibrate sufficiently to break the cement bond. Once this is found, the post will loosen fairly easily. Again, cooling is very important when doing this. In situations where ultrasonics do not result in easy removal, a device such as a Ruddle or Gonon post remover is used to tap the visible part of the post, engage it, and lift it from the tooth. These devices are very technique sensitive and depend upon creation of a machine-threaded area of the post to allow them to engage it and apply upward pressure, upward vertical forces necessary to remove it. Caution should always be observed when applying these devices. Failure to adhere to these precautions can result in fracture or chipping of adjacent teeth or restorations while you attempt to remove the post. Dentatus screw posts are frequently used by European clinicians because of their great retentive property. Unfortunately, because they're screwed into the dentin, they're also responsible for high numbers of fractures. That's why they should not be used. In cases where dentatus posts are present and the root canal treatment must be retreated, sometimes the entire existing restoration must be removed or the axis made large enough to enable reverse unscrewing rotation of the post to allow for removal. Again, these posts are not difficult to remove, but there must be sufficient room to allow for rotation of the screw with either a small hemostat ultrasonic tip or an instrument. I'm frequently asked to remove prefabricated posts in anterior teeth that have fractured off at the gingival line. These are generally pretty easy to remove, but without re-evaluation and redesign of the retentive properties of the new restoration, this will likely occur again. Crown preparation must establish adequate ferrule to prevent forces from being exerted directly on the post, resulting in exactly the same kind of post-fracture in the future. If there's insufficient tooth structure, or if the patient does not wish to undergo either crown lengthening or forced eruption, extraction should be considered rather than replacing the existing post with one which will result in a similar post failure. Multiple post placement and the use of posts has been addressed in one of the other videos. Suffice to say that in posterior teeth, roots are generally curved and clinicians must exercise extreme caution when placing them in a tooth. There's no justification for placing posts in mesial buccal roots of maxillary molars or mesial roots of mandibular molars. In most cases, posts are not necessary at all, but when they are, the thickest, straightest root should be chosen and the other roots left alone. When in doubt, take a cone beam tomograph to better assess the 3D situation. A single post and some well-placed retention spaces in the adjacent canal orifices will usually provide adequate retention with minimal risk to the tooth. Lastly, a word about post removal through existing restorations. I'm often called upon to retreat cases that have been previously stored with a post and core crown. Most often, all the canals of these teeth have to be retreated. It's amazing how many of these teeth can be retreated by making access through the crown, removing the post, retreating all the canals, and then re-restoring the tooth without a post in place. We can only conclude from this that the post really didn't provide significant retention for the existing core, and that it was likely unnecessary from the start. In the worst-case scenario, retreatment is necessary because placement of this post actually caused a post-based perforation. The post is removed, the perforation is sealed, and the canal is refilled and the tooth is restored, this time without a post. The fact that the crown remains in place without the post is a good indication that the retention of the core material was adequate without the post, and it was unnecessary from the start. The general rule is this: when in doubt, don't use a post. In all but the most severely broken down cases, removal of gutta percha from the orifices and establishment of retention spaces for the core material is usually sufficient to provide enough retention for the core to be retained. Thanks for watching. Remember, when we do the right thing, we both get better, patients and clinicians. Don't forget to like and subscribe. Subscription to this Beyond the Terminus channel is free. I look forward to our next trip when we go Beyond the Terminus. See you then.